Dear student, in yesterday's class, we have discussed about what are the antibiotics and their classifications, type of classification based upon the spectrum of activity, from which source they are divided, and uh, what are the structural similarities likewise depending upon the chemical structures and all. So all these types of classification, and we have started a discussion on very first antibiotic, that is penicillin. So we have discussed everything about penicillins in previous two lectures. Now today we are moving towards the next classes of antibiotics, that is cephalosporin. Now, cephalosporin is a second class derivative of the antibiotic. The name given as cephalosporin C. That cephalosporin C was isolated by a person, that is Newton and Edward Abraham. Cephalosporins are also the class belongs to the antibiotic, that is beta-lactam antibiotic. While we are discussing the penicillin class is also an beta-lactam antibiotic because they contain beta-lactam ring which is fused to the thiazine heterocyclic group. Now in the case of cephalosporin, that 4-membered beta-lactam ring is fused with the 6-membered thiazine ring containing thia belongs to sulfur and aza belongs to nitrogen, INE belongs to the 6-membered heterocyclic ring. That means in the case of cephalosporin, they contain the class is same as like that of penicillin, that is they are also an beta-lactam antibiotics, but containing this beta-lactam ring is fused with the 6-membered heterocyclic ring containing sulfur and nitrogen in their structure. Cephalosporins were isolated by the now we have discussed that Alexander Fleming has discovered or isolating the antibiotic penicillin from which class? Yes, from which class? It is derived or isolated from the Penicillium notatum. Have you remembered the same? Similarly, cephalosporins were isolated by a Italian scientist, that is Brozzo, from the cultures of Cephalosporinium acremonium. This is also a fungal derivative like that of penicillin. Penicillin is also an extracted from the fungus mode, that is Penicillium notatum. Cephalosporin is also isolated from the fungus mold, that is Cephalosporium acremonium. So the name of this antibiotic, that is cephalosporin, is given by from which derivative is it is extracted or it is prepared from the cultures of Cephalosporinium acremonium. So he noticed that they are effective against the infections, that is Salmonella typhi. That means we can use cephalosporins drug against typhoid type of fever. So we can treat the typhoid with a cephalosporin containing beta-lactam ring in its structure. Now this slide gives an focus on what type of diseases we can go for the use of cephalosporin. Cephalosporin is used to treat the pneumonial infection, staph infections, the swelling of the tonsil glands, that is tonsillitis, swelling of the bronchi, that is bronchitis, otitis media, and various types of skin diseases we can treat with the help of cephalosporin, like gonorrhea, urinary. We can use the cephalosporin drug to treat the urinary tract infections as well. Cephalosporin antibiotic are commonly used for the surgical prophylaxis. So after the surgical operations, we have to go to, give the patient the prophylactic drug in order to avoid the bacterial infection. So cephalosporin is the choice of drug when any patient is undergoing any surgical operation. So the cephalosporin is used to treat that post surgical prophylaxis treatment. Cephalexin can also be used to treat the bone infections. Cephalexin is a cephalosporin derivative we can use to treat the bone infections. Now we are moving towards the structure activity relationship of the cephalosporin and the discussion about the detailed discussion about the structure of cephalosporin. Already in the first slide we have discussed that cephalosporins are the drug containing 4-membered beta-lactam ring is fused with the 6-membered thiazine ring containing sulfur and nitrogen heteroatom in its structure. We have assigned sulfur number 1, that is lowest possible number to the heteroatom sulfur. This is dihydrothiazine ring attached to the beta-lactam ring. Beta-lactam ring is fused with the dihydrothiazine ring which is required for the antibiotic activity, and this entire ring containing 4-member beta-lactam attached to the 6-member dihydrothiazine ring, this entire structure denominated as a cepham. That means we can use this whole overall structure is cepham. Substitution at 7th position. If anything is substituted at this carbon atom which is assigned the number 7 of the beta-lactam structure, alters the spectrum of activity of various cephalosporins. That means if anything is substituted at this carbon number 7, it will either increase or decrease the spectrum of activity towards what we have discussed. In case of spectrum of activity, they are effective against either gram positive or gram negative microorganisms. So if we are going to substitute anything which is at carbon number 7, it will alters or change the spectrum of activity towards the infections. So at 3rd position of the dihydrothiazine ring, if we are going to substitute thus R with any functional group, substitution with various groups changes the pharmacokinetic properties of various cephalosporin. Now what are the pharmacokinetic properties? Absorption, distribution, metabolism, excretion and toxicology. Toxicology is the newly added term while we are discussing the pharmacokinetic parameters of any drug. That means anything if we are substitute at carbon number 7 which alters the spectrum of activity, and anything if we are substituting at carbon number 3 which will alters the pharmacokinetic properties of the cephalosporin derivatives. And what are the pharmacokinetic parameters? Pharmacokinetic parameters are absorption, that means anything which is substituted at carbon number 3 maybe with the hydrogen or maybe with the this R2 belongs to change the absorption parameter, distribution pattern, metabolism parameters or metabolism through which metabolism pathway they are metabolizing, excretion and toxicological parameters. Now these class of cephalosporin is further classified into depending upon their generations. So they are classified as a from 1st generation to the 5th generation. Now this generation type of classification is through what concept or through on what base they are classified. Class of cephalosporin, whether it is active against gram positive or whether it is acting against gram positive or gram negative microorganism, depending upon that they are further classified from 1st generation cephalosporins to the 5th generation cephalosporin. And there are various examples which are coming under the category of 1st, 2nd, 3rd, 4th and 5th generation. We are moving towards the discussion of 1st generation cephalosporin. They are cephalexin, cefaradine, cefadroxil, cephalothene and cefaperin. 2nd generation cephalosporins are cefuroxime, cefaxetine and cefalor. 3rd generation cephalosporin is cefixime, cefpodoxime, ceftriaxone and cefoperazone. 4th generation cephalosporin cipepramide, cipramome, and cifetinome. Fifth generation, ceftobiprole, ceftaroline, ceftaroline, ceftazolone. First generation cephalosporins are selectively active against gram-positive bacterial strain, with succeeding generation progressively more active against gram-negative bacterial strain. So the first generation cephalosporin, just now we have discussed that they are selectively active towards the gram negative, आणि जसजसं आपण पुढे जाऊ from first generation to the fifth generation, they will increase the activity against the gram negative bacterial strain. For example, fourth generation cephalosporins are extended, or they are going to have the extended spectrum of activity antibiotics. Now we are moving towards the individual discussion of the cephalosporin class and their examples. So the first antibiotic belong to the class of cephalosporin is cephalexin. This is first generation cephalosporin, which is used to treat the infections which are caused by the gram-positive bacteria. We have already discussed that first generation cephalosporins are active against they are selectively active towards the gram-positive bacteria. That's why cephalexin is an antibiotic used to treat the infections caused by gram-positive bacteria, to treat the upper respiratory tract infections of ear, skin, urinary tract, and bone infections. Our second class of antibiotic is cephadroxil. Cephadroxil, see the complex structure of the cephadroxil containing 4-member beta-lactam ring, which is fused to the dihydrothiazone ring containing sulfur and nitrogen as an heteroatoms. So this is also the class of first generation cephalosporin antibiotic, which is used to treat the bacterial infections, specially used to treat the infections of throat, skin, and urinary tract. They are also used to treat the infections caused by the gram-positive bacteria. We have discussed that we are moving from the first generation to the fifth generation antibiotic. They are increasing their spectrum of activity. On this basis only they are classified as from first generation to the fifth generation. But this, no doubt, this is a first generation antibiotic. They are active against the gram-positive bacterial infection. Next example is cefixime. Cefixime is a third generation cephalosporin which is there in the market, effective against gram-positive as well as gram-negative bacterial infection. We have already discussed if we are coming from the first to the second, third, fourth, and fifth generation sequentially, depending upon the change in the generation, they will changes their effectiveness, or they will alter their structure in such a way that they are moving towards, or they are increasing their spectrum of activity from against gram-positive and gram-negative bacterial infection. Cefixime is resistant towards the beta-lactamase enzyme, and which is used to treat the typhoid fever and biliary tract infections. Next is cefapyridine. Cefapyridine. Cefapyridine is also known as cefapyridine because the seventh position of the beta-lactam ring is sequentially attached to the pyridine ring, or the containing the pyridine ring as a heteroatom. So the name of the drug is cefapyridine, also known as cefapyridine. Cefapyridine is also a first generation cephalosporin combined with the prednisolone to use in the cattle for maintaining the inflammation of the inflammatory glands and its production of the milk. That means they are used to treat the inflammations of those glands which are involved in the production of the milk in the case of cattles. Next, cephalosporin act as an intrauterine preparations in the clutter. They are used in the preparations of the intrauterine preparations in the cattles. This has been banned for usage in the human being. That means this particular drug is only used to treat the inflammation and infections caused to the cattle species, and they are totally banned to be used for the human beings. Cefuroxime. The cefuroxime is second generation cephalosporin used to treat the gram-negative bacterial infection. See, first generation is selectively active towards the gram-positive bacteria. Second generation, from moving towards second, third to the fifth generation, there is increasing in the spectrum of activity. Third and fourth, fifth generation, they are slightly active against gram-positive as well as gram-negative bacterial infections. Cefuroxime is the safest antibiotic during pregnancy. So that means we can give this drug to the pregnant woman in order to treat her bacterial infections. This is also used to treat the infections and inflammation of the tonsil glands, laryngitis, bronchitis, throat infections, pneumonia, gonorrhea, also used to treat the urinary tract infections which is caused by the susceptible bacteria. Now, what will be the mechanism of action of this cephalosporin class of antibiotic? We have already discussed the mechanism of action of penicillin. What is the mechanism of action of penicillin? Penicillin is coming under the category of what type of antibiotic? Penicillin is coming under the category of antibiotic which are interfering in the formation of the cell wall. Similarly, this antibiotic, that is cephalosporin, is also interfering in the synthesis of bacterial cell wall. Now we all know cell wall contains a presence of amino sugar, that is N-acetyl muramic acid and N-acetyl glucosamine. So there is presence of these amino sugars in the structure of cell wall of the bacteria cell, and peptidoglycan residues are linked together to form the strands, and UDP, that is uridine diphosphate, is split off. This peptidoglycan strand contain the presence of nitrogen base, that is uridine diphosphate, which will split off. Then the cleavage of terminal D-alanine of the peptide occur by transpeptidase enzyme. This process is known as transpeptidation, that is cleavage of the amino acid at D-alanine. This process is called as transpeptidation. The cross bridging provides necessary strength to the bacterial cell wall. That means D-alanine is going to form a cross bridge with the another peptidoglycan ring, and this process is known as transpeptidation, and this formation of this bridge with the D-alanine provide strength to the bacterial cell wall. But the problem, that is beta-lactam antibiotic inhibit this transpeptidase enzyme, which will strengthen which will give the strength to the bacterial cell wall. That means beta-lactam antibiotics stop the process, that is transpeptidation enzyme, so that cross-linking of the nitrogen bases does not take place. This leads to the formation of cell wall deficient bacteria and cause shrinkage of the bacterial cell wall. Due to inhibition of the procedure of transpeptidation, because transpeptidation provide the rigid cell wall to the bacterial cell, and these antibiotics will inhibit the transpeptidase enzyme, which is involved in the cross linkage of the peptidoglycan amino acid layer, As this enzyme is inhibited by the beta-lactam antibiotic, there will not be further cross-linkage happen, and due to cross-linking does not take place, the cell wall is not formed properly. That improper formation of the cell wall causes shrinkage of the bacterial cell. Cephalosporins shows bactericidal. In first class only we have discussed the difference between the bactericidal action and bacteriostatic action. Bactericidal action means killing of the bacteria. That means due to inhibition of transpeptidase enzyme, and due to this inhibition there will not be cross-linking happen, or cross-linking does not take place. Due to inhibition of this cross-linking, the cell wall is not formed properly, and bacteria is having deficient cell wall formation, cause the shrinkage of the cell. This is N-acetylmuramic acid and N-acetylglucosamine, and this N-acetylmuramic acid is going to form the cross-linking with the N-acetylmuramic acid. But as cephalosporin is going to inhibit the enzyme, that is a transpeptidase, will not form or will not complete the procedure of transpeptidation from first strand of N-acetylmuramic acid to the second strand of N-acetylmuramic acid, as the enzyme is blocked by the drug molecules. That's why the cross-linking does not take place, and there is a formation of deficient cell wall deficient bacteria are formed, which will die the bacteria. Next, side effects of cephalosporin type of antibiotic. The pain and inflammation. If we are going to give this cephalosporin through injection route, there is pain and inflammation at injection site, diarrhea, hypersensitivity reaction, there is toxic reactions to the nephron cell, bleeding, pain on intramuscular injections, then nausea, vomiting, swelling of the coli. These type of effects are shown by the cephalosporin. Now next class is beta-lactamase inhibitors. Now there are enzyme which will metabolize the beta-lactam ring. Now what is beta-lactam ring? Beta-lactam ring is present, which is attached to the either thiazole ring, or it is attached to the thiazine ring in the case of cephalosporin. Now there are drug in the market which will inhibit the metabolism of the beta-lactam ring, and they are coming under the category of beta-lactamase inhibitors, are the class of antibiotic drug which block the activity of beta-lactamase enzyme. Now what is beta-lactamase enzyme? Beta-lactamase enzyme responsible for the degradation of beta-lactam. Beta-lactamase inhibitors inhibit the degradation of beta-lactam antibiotics by acting on the bacterial microorganism, and the examples are clavulanic acid and thiacinamide. So the first example of beta-lactamase inhibitor is clavulanic acid. Amoxicillin clavulanic acid is a combination used to treat variety of bacterial infection, but it stops the growth of bacteria. Next class is thiaminamycin. This is a drug containing beta-lactam ring attached to the 5-membered ring. This is naturally produced by beta-lactamase inhibitors. This is antibiotic promoted from Streptomyces cattleya, and they are used to treat the gram-positive as well as gram-negative bacterial infections. Now the mechanism of action of beta-lactamase inhibitors are: beta-lactam antibiotics interfere with the synthesis of cell wall. After attachment of penicillin to the binding protein of bacteria, they inhibit the transpeptidation enzyme which cross-link the peptide ring attached to the backbone of the peptidoglycan. The final bactericidal action is the inactivation and inhibition of autolytic enzyme in the cell wall, leading to the lysis of bacterium. So some tolerable microorganisms have deficient action or defective autolytic enzymes in which lysis does not occur. Some newly introduced class of antibiotics are monolactam. Monolactam means is a monocyclic ring and bactericyclically produced by the beta-lactam antibiotics. Now, till this moment, we have discussed about the penicillin, classification of antibiotic, class of antibiotic. We have started discussion on cephalosporin. Cephalosporin contain beta-lactam ring attached to the thiazine ring. Penicillin contain beta-lactam ring attached to the thiazole ring. Now in the case of monolactam, they are monocyclic and bacterially produced beta-lactam antibiotic. The beta-lactam ring is not fused to another ring. They are monolactams are effective only against aerobic gram-negative bacteria. They are also called as monobactams. They are sulfazacine, azithromycin, and tigmonum. Monolactam inhibit the bacterial growth by interfering with the transpeptidation reaction of bacterial cell wall synthesis. Monolactam covalently bind to the penicillin binding protein to prevent growth of the cell wall via peptidoglycan synthesis. So they also inhibit the formation of interfering with the transpeptidation reaction as like that of cephalosporin. During the formation of bacterial cell wall, they are covalently bind with the penicillin binding protein to prevent the growth of cell wall via peptidoglycan synthesis. Examples of classes of such drug are sulfazacine. This is a structure of sulfazacine, active against gram-negative bacteria and their infection. Next example is azithromycin. This is used to treat the sepsis, that is pus cell formation in the affected area. This is also used to treat the respiratory tract, biliary and gastrointestinal and female genital tracts. There also azithromycin is active against aerobic gram-negative bacteria. Tigmonum, orally active monobactam, highly resistant to the beta-lactamase enzyme. This is active against Enterobacter, E. coli, Shigella and Proteus infections. So this is all about the classes, that is today we have started discussion from cephalosporin, then beta-lactamase inhibitors, then we have covered a very important time is beta-lactamase inhibitor under the class monobactams. So thank you.